Okay, I'm with Mary Bauer at the Laser Lounge in Georgetown, and she's going to demonstrate the Erbium Pixel on starting to get some pigmented lesions, so she's going to zap some of those for me. And this is a great treatment. Again, you can treat all skin types with this pretty much. It just helps get that pigment up and out, and you get this micro crusting after a day or so. You get kind of bronzy, and then that just peels off after a few days, and the skin is refreshed and clean looking. The pigment is reduced, and sometimes people get 2, 3, 4 sessions of this, maybe 3 or 4 weeks apart. So she's attached the smoke evacuator to it because it is ablative. It's kind of micro ablative. It doesn't penetrate super deep like a CO2, so you don't have to worry about a lot of residual potential scarring or hyperpigmentation, hypopigmentation, things like that with this, because it's so highly absorbed in water. It stays superficial, so it makes it safe, that it's effective, really popular. 2940 Erbium. Erbium is an erbium, so whatever you use, it's going to be the same wavelength, but this is a nice popular one. So it's 49 little beams of light. So the difference between pixelated like this and a regular single beam is that it's fractionated or pixelated into multiple little beams, which makes it kind of like plugging the grass versus scraping all the grass off on your yard to wait for it to grow back. So it just makes it much less downtime. So anyway, so she's going to zap a few of these for me, and here we go. I'm just going to close my eyes, so make sure I should have goggles on, but I'm closing my eyes. I'm not worried about it. Just for the video. And that's all there is to it. It's not painful. It's just little light rubber band snaps. Discomfort is usually for a couple of hours after the treatment. It's hot, but then it calms down pretty quick. So she's just spot treating the pigmented lesions for me, and then the smoke evacuator is picking up the plume. So this is different than a sublative laser, where you wouldn't have to have the smoke evacuator because there's no plume, but this one actually is ablative. Okay, any more on that side, or
looks good.
Anything over here? Okay, so she's going to do a few on this side. So I can feel it over here. It's a little hot, but it's not bad. So normally what you would do is do the whole face, and then again you might do the pulse light on top of that first, and then do this on top of that, or do them as separate treatments. So a few more on this side, and that's it. All right, that was it. Pretty quick and easy. So that was the Alma Pixel 2940 Erbium laser.